It's a really valuable tool, and I don't want to be trite about it and sound overly endorsing, but it is as important as my stethoscope. It is as important, or more important, from the study that we did at the Longines Masters than a thermometer. But it's part of the tool, and using this test, we're finding out more and more about its importance, about where we fit it into our practice, how to reduce antibiotic usage in horses, how to monitor the monitoring of disease. So as we treat a patient and we see that our therapy is successful or unsuccessful, the SAA is incredibly valuable in changing the course of how we treat that patient. The actual test and the study that we did at the Longines Masters in Los Angeles was remarkable for me personally as a doctor, because here's a guy who, I believe in the test, I've used it for a couple of years now, I trust it, but I actually kind of achieved a different level of trust, because finding a horse that was sick with an elevated SAA, being alarmed by the numbers, I had a little bit of a leap of faith, and the groom telling me he wasn't quite right. I couldn't find anything wrong with him. Temperature was good, CBC was good, everything else was normal on the horse, but I had this SAA test that was not good. And it was a little bit of a leap of faith for me to start treating that horse, and it was a leap of faith in the client, in me, allowing me to start the horse on antibiotics, when 12 hours later, that horse blows up with a giant, painful cellulitis, creating a lameness and potentially taking him out of the show. The short version of that is the horse got better because of our early treatment, and that early treatment allowed him not only to go on to perform, okay, it was a bonus, he won the class, he won the Grand Prix. That's awesome, but that could be at any show, at any level, a little kid's pony. This just happened to be an international Grand Prix horse. But the earlier we can diagnose disease and the earlier we can treat disease, the more successful we are going to be in our therapy. Last year at the World Cup finals, we had a bunch of us team vets, and we were actually short on Stablelab tests, and we were all borrowing them from each other. So, hey, do you have any more Stablelabs? Do you have any more Stablelabs? Because we all didn't bring enough of them with us. And there wasn't an outbreak of disease, there wasn't an unusual number of sick horses, but for sure we had a few sick horses that we normally do at competitions, at major international competitions. And what we wanted to do was monitor these horses and follow the trending of our treatment on SAA horses. We did have a couple of sick horses, several of us from different teams, and so we wanted to watch the trending of the SAAs. Just as you need practice with your stethoscope and you need practice with your ophthalmoscope, you need practice with your nerve blocks, the more you use it, the more you will find value in using it. And that's what's been really exciting to me about talking to these other doctors and how they use it. I really need a analytical stall side test in my practice. I've always needed it, but I never dreamed or imagined that it would happen. It's like asking me if I took away digital radiography, would I live? Okay, I'd live, but I wouldn't be as good a doctor. And Stablelab has made me a better doctor, as well as digital radiography has made me be a better doctor. Two entirely different diagnostic tests, but equally important in treating those cases, because at the end of the day, my job is to make horses feel better and to prevent disease and to manage elite sport horses. And the Stablelab really helps me do that. It's an invaluable tool.